I want to welcome you to the second webinar in the Language Access Continuing Education series. My name is Susan Clifford, and I work as the Language Access Coordinator at the UNC Institute for the Study of the Americas in Chapel Hill. I'm here with my wonderful colleagues from Building Integrated Communities. Some of you may have been part of or connected to our 2023 Local Government Language Access Cooperative, which took part in a year-long course on language access, or you may be part of the BIC partnerships, the Building Integrated Community partnerships that we have. However, there may be some others of you who are new to the collaborative and the work we do here at the Institute. So you will see that we have our website posted here, and again later on our, on a later slide as well that we will share with you. We hope you will visit our webpage to learn more about our other webinars and the immigrant integration work we are doing in communities across North Carolina. We really see language access as the first step in civic participation. Multilingual staffing and interpretation services are essential for community members who speak languages other than English to have meaningful access to services, inclusion in government agencies, and representative leadership. We have a great variety of attendees on the webinar today. We have some students, some community members, some language justice advocates, and folks who currently work in local government. So welcome, everyone. Oops. So now I would like to introduce our wonderful guest presenters. We are fortunate to have from the North Carolina Department of Health and Human Services, David Payne and Dianne Shearer joining us to share their expertise with us. So David Payne has his Bachelor's of Science in American Sign Language Interpretation with a minor in Spanish from UNC Greensboro and over 15 years of interpreting experience. He is nationally certified by the Registry of Interpreters for the Deaf, and he holds the specialty certification Qualified Mental Health Interpreter. David has worked as a trilingual interpreter in multiple contexts and now works with the Department of Health and Human Services Division of Services for the Deaf and Hard of Hearing as the manager of their communication access services for staff and consumers. And also joining us is Dianne Shearer. Dianne hails from Boston, where she worked at the Massachusetts Commission for the Deaf and Hard of Hearing as the Director of Interpreter and CART Services for 13 years, where she directed and managed the overall operation and planning of the department, including a statewide referral service for use by public and private agencies, management of interpreters housed in central and regional offices, and administering the state contract for interpreter and CART services. Currently in her position as Assistant Director with the NC Division of Services for the Deaf and Hard of Hearing, Dianne is responsible for administration of operations and budget of the division. She also oversees programs and services that provide consultation, education, and advocacy on communication access, assistive equipment, distribution, and resources and referrals. Well, welcome, Dianne and David. So happy that you are here with us and so thankful for your expertise and ability to share your resources and expertise with us today. I'm going to stop sharing my screen and turn off my camera and then turn it over to Dianne and David. Welcome.
This is Dianne. Thank you. I'll let David pull up our PowerPoint before I get started.
This is David confirming. Do you see the PowerPoint? Okay.
This is Dianne. All right, good morning, everyone. Today, we are going to be talking about language access in a trilingual environment. Next slide. I will explain a little more in detail about the Division of Services for the Deaf and Hard of Hearing. We do provide advocacy, consultation, education, information and referrals, and outreach services. We also have an equipment distribution program like Susan mentioned in my bio. We also serve all of the people in North Carolina, not just those with a hearing loss, but everyone who comes to our state, not just residents, even the visitors that are in North Carolina, students who are here at the university, people who are on vacation in North Carolina. We really serve everyone who is here in our state. As a state agency, we do not charge for any of these services that we provide. We welcome all questions to our agency, and we're happy to assist in any way that we can. We do have regional centers located across our state. You can see the map here on this slide indicating each of the centers by color-coded sections. We serve from the western part of the state to the eastern part of the state. We have a regional center in Morganton, in Charlotte, Asheville, Greensboro, Raleigh, Wilson, and Wilmington. We also have our central office, which is located in Raleigh. Next slide.
This is David Payne speaking. So I want to talk to you a little bit about interpreting for American Sign Language in North Carolina. There's some things that are different about ASL interpreting than spoken language interpreting. One of those big differences is that in North Carolina, to interpret as an American Sign Language interpreter for pay, you must have a license. That license law is under General Statute 90D. If you're interested in looking that up, the best place to find it is there's a website at the bottom of this slide, the ncitlb.org. That is the North Carolina Interpreter Transliterator Licensing Board. There are two settings that are currently exempt from licensure. Those are educational settings and religious settings. North Carolina is a little interesting in that of the states that license ASL interpreters, most of them license education or all settings. North Carolina licenses community settings and not educational settings currently. There is a push among the interpreting community and the deaf community to look at removing that educational exemption. And you might imagine why that could be important. We're talking about the education of deaf children. We want to make sure that those interpreters are qualified. And the goal of the licensure law is to assure some minimum standard of competency for interpreters so that it protects deaf community members that are relying on American Sign Language. That licensure law includes two types of license, a full license and a provisional license. The provisional license means that the person holding that license does not have their national interpreter certification from the Registry of Interpreters for the Deaf. A full license means that that person was either grandfathered in at the time the law was passed or has a national certification. So if you are ever hiring American Sign Language interpreters, it's important to know that they are required to be licensed, and the licensure law requires that they provide you their license number if on request so that you can verify that. And you can go again to the North Carolina Interpreter Transliterator Licensing Board website. And there is a spot at the bottom you can click on that says current licensees. You can search by that license number, or you can search by the name to find that person and ensure that they do have a valid current interpreting license in North Carolina. Now, there are a couple of other situations where you can use an unlicensed interpreter. One of those is in emergencies. If there is not a licensed interpreter available in an emergency, you can use an unlicensed individual until a qualified licensed interpreter can be secured. It's also important to remember, and this applies to any interpreting, certifications and licensure do not necessarily mean the same thing as qualified for a particular situation. And we'll talk more about that as we go through the presentation. So now I want to address some of the differences with spoken language interpreting. There is no licensure requirement in North Carolina for spoken language interpreting. There's also no single nationwide standard of like certification or credentialing for spoken language interpreting. A lot of that is just because there are over 350 languages spoken in the US. There's no possibility of one certifying body that could handle certifications for all of those languages in all of the contexts that they may be operating. So for each language that you're securing interpreters, there may be different certification and credentialing. There may actually be no certification or credentialing available for some languages, depending on the size of that language group. Also, training for interpreters is limited. There are schools and programs that provide training for spoken language interpreters, but many people who work as spoken language interpreters do not have formal interpreter training. So when you're hiring interpreters for spoken language, those are other important questions to ask. What kinds of qualifications are available for someone in this language? What is the actual availability of interpreters in that language? And if there are different certifications or qualifications available for that language, how do you ask for those things when you're securing interpreters? How do you ensure that the interpreter you're getting does have the necessary qualifications for the setting that they're working? That can be a very difficult thing to determine. Again, if you're talking about Spanish, there are quite a few resources for interpreter training. There are a variety of certifications available, some specialized in legal settings or medical settings, some that are more generalist. But if you're talking about a very small, perhaps native language in the US, an indigenous group language, there may not be any interpreters available that have any formal training. If you're talking about some smaller indigenous language group from Central and South America, it may be very difficult to find interpreters that have any training or credentialing in that language, simply because there may not be training and credentialing in that language. So it's a very complex kind of ball of wax that you're dealing with when you look at all of these different languages and hiring interpreters. Most of the rest of the presentation will be talking about Spanish, because that is probably the most common that you'll encounter, and American Sign Language. One more thing I wanted to mention. There's some data that would indicate we have more than 42 million people that use Spanish in their home. So 42 million versus there's about 67.8 million people who speak some language other than English. So that is why we tend to focus on Spanish, because it's by far the largest language group that is not English speaking. But that does leave a couple tens of millions of people that use languages other than English that are not Spanish. So you may be encountering those as well. We'll go to the next slide, and I'll turn this over to Dianne.
This is Dianne. Hearing loss is on a wide spectrum and ranges from individual to individual, and it can vary by degree. So you may be serving different populations. One would be deaf, hard of hearing, or deaf-blind. For the deaf population, someone could be born deaf, like myself, and they're deaf from unknown causes. Some people lose their hearing later in life, and they could be identifying themselves as late deafened individuals. They may have some residual hearing that they utilize, and they would be hard of hearing. Each of these different populations have different modes of communication. The deaf population primarily uses American Sign Language as their first language. The hard of hearing individuals, some may know sign language, some may not, and still use English, but it will vary person to person. For deaf-blind individuals, they may have been born deaf and then lose their vision later in life, or vice versa. Could be the opposite scenario. They had a vision loss initially and then lost their hearing later. It could be a variety of different situations. People who are culturally deaf and then lose their vision and become deafblind typically use what's called tactile sign language, which is where it's hand over hand with a person who's using sign language. I'm showing you right now what that would look like with someone's hand on top of another person's hand using sign language. That's called tactile ASL. There's different types of ways to access each of these populations. One would be to provide an American Sign Language interpreter or a translator. You may be wondering what a transliterator is, as you see on the screen, that title. It is someone who's using sign language, but in English word order. You could also provide communication access real-time translation, which is CART services. And that is also considered captioning. So if you have the captions on today, you can see what that would look like in real time. And it shows those on the screen here in Zoom. And everything that is being said is then typed out in the captioning. The captionist is using special equipment called a stenograph, and that connects to a software, a phonics-based software. And they have their own dictions, and it is embedded in the software. So they may be typing just 2 or 3 keys on the stenograph, and it creates a full word in captions. They typically can type 260 words per minute, which is really quick and real time. And then tactile American Sign Language is another type of access that can be provided to the deafblind community. Okay, next slide. This is a graph of the projections, and we are anticipating a large increase in the number of people with hearing loss over the next several years. That is projected out to the year 2030 on the graph. So it starts at 2017 with 1.2 million individuals with hearing loss. And I just want to remind everyone, these are statistics from people who are disclosing a hearing loss, but oftentimes people don't disclose a hearing loss, or maybe they're not even aware that they have a hearing loss. So this number is based on the people who do indicate that they have some degree of hearing loss. And then they're projected to see a 33% increase in that number over the next couple of years to the year 2030. You'll see that number. Many people don't realize that environmental noises can impact your hearing ability. So, for example, if you're just out cutting the grass using a lawnmower and being exposed to that sound can impact your hearing. Or your Apple AirPods that you put in your ear canal. A lot of young people are using these AirPods, and it's directly in their canal, and that can impact their hearing ability as well. It could be at a concert too, where you're exposed to a lot of loud noises. All of these factors contribute the level of hearing loss in an individual. So it's important that you protect your hearing in these types of environments. Okay, next slide. I want to talk a little bit more about American Sign Language. It is my first language, my native language. When my parents first found out that I was deaf, and my whole family decided to learn American Sign Language together to be able to communicate at home with me. This was when I was really young, before I started school. And I'm really fortunate to have that situation in my home life, because many deaf and hard of hearing children, their parents do not learn sign language. And it's a sad fact, but a true fact. And American Sign Language, people often assume that it is just broken English or just visual words, but really it's its own language with a special grammar and syntax of its own, different from English. American Sign Language grammar structure does not follow the same grammar structure of English. As I mentioned before, there is transliteration, which is not the same as American Sign Language. It is a sign language in English grammar structure, so it differs from American Sign Language. I will provide an example showing you the grammatical structure of ASL. It's on the next slide. So this is ASL grammar. If we could describe it this way in a written form, the English would be the boy threw a ball. But grammatically in ASL, it's structured differently. So the signs are in different order. So you would see the ball, boy throw. And so if the boy throws the ball and breaks a window, then you would see the emphasis on the ball, because that's going to be the subject or the topic of that sentence. And so the subject comes first. So you would show the ball and then the boy throwing the ball, the action, the verb. If the sentence was different and it was a boy threw a ball, that would be signed differently, that a boy as the topic and then throwing the ball as the action, as the verb. There's another example here on the slide. The English sentence is, I washed my car. In American Sign Language, you would start with the subject, which is the car. That's what's being discussed. And then the verb, and then the time reference, showing that that sentence is in past tense. Okay, next slide.